Oral chelation and EDTA.
Yeah, and you just wait until you hear the success stories we've had with that.
Incredible success stories for over 20 years, huh?
Yeah, nearly 40 now.
40 years. Heart disease remains the major cause of health complications and death in spite of all the advancements in science. One of the lesser talked about methods for both preventing and possibly managing safely is chelation. Tell us a little bit about chelation and your experience with it.
The word chelation means to bind or bring together. So, for example, when we create a calcium supplement, we bind it with acids, amino acids, citric acid, malic acid. Why? Because it enhances the absorption in the stomach. Well, we can use the same concept of binding to take things out of the body. For example, heavy metals, calcium ions that are sticking to your artery walls where you don't want them to be. Mm-hmm. And we can do so relatively effectively and with virtually no side effects whatsoever, providing obviously that it is done correctly. Chelation has been used for at least 40 years. It has evolved like many other things in medicine and science, and today it is near perfect in its administration and application.
And what's the difference between oral chelation and intravenous?
Well, both use artificial or synthetic amino acids, and the main one that we use is EDTA. And that is a synthetic amino acid, which is what makes it work, by the way, because it can't be broken down in the body because the body doesn't recognize it.
And what does EDTA stand for?
A very big, long word.
Oh, okay. All right.
That no one would remember past 5 minutes from now.
All right.
But both EDTA can work intravenously and orally. Intravenous chelation is more aggressive. Because obviously when you're infusing something into your bloodstream directly, you're getting a higher dose, you're getting greater potency, you're getting volume, and that produces a shorter and more effective response.
Yeah.
Oral chelation is not less effective, but it takes longer. So the duration of time to get the ultimate benefit is considerably longer. However, both of them have pros and cons. Intravenous chelation is very expensive. You're looking at $4,000 to $6,000 plus for a series of treatments. Plus, which you have to travel to an intravenous chelation center in order to get. So unless you live in the neighborhood, you've got travel and hotel and a host of other experiences. Now, if you're in an acute situation where you have a major arterial blockage, obviously intravenous chelation and those issues would be worth it.
Yeah.
But for most people who can practice some prevention, get things under control before they get too severe, oral chelation is ideal. It can be done at home. It's relatively inexpensive. You do have to do it for a minimum of 6 months or longer because it works slower. But you don't have to travel. You can do it in the comfort of your own home by taking some capsules.
And these are all the reasons why you prefer oral chelation over intravenous.
Yes, simply because of the cost factor and of the convenience, mostly. And again, if you have a very acute situation, an initial series of intravenous chelation treatments might be necessary up front, and then follow it up with the oral chelate afterwards.
And what makes up an ideal oral chelation formula?
Well, one of the drawbacks to chelation therapy is that it is not selective with the minerals that it chelates. So not only is it going to chelate and remove calcium ions from your arteries, it's also going to remove other potentially beneficial minerals, which can create electrolyte imbalances and a host of other things. People get leg cramps from a lack of magnesium and so forth. The advantage of oral chelates is that we can put those minerals in the oral chelation formula, so you never are in a position of deficit.
Okay. So you're taking out the bad and putting in the good that was removed by taking out some of the bad.
Yes, because you can't be 100% selective.
And so what are just a handful of the ones that really stand out to you of the success stories that you've had with your oral chelation formula?
Well, I most recently, we had clients come to us, and the husband had 70% plus blockage in two major arteries.
Wow.
And the doctor wasn't horribly concerned. I don't know why, but he wasn't. And he said, well, we're going to just watch it. And I said, so they called, and I said, well, while we're watching it, why don't we do something proactive about it? And we started him on the oral chelate formula. And basically, in 6 months, he went back to his doctor, and the doctor said that the blockage had been significantly reduced, and he saw no need for further intervention.
Man, that's just beautiful. And everything should always be, decided by your doctor. And to find out what your doctor thinks is best for you, they should always do that. But in something that simple, it's so beneficial. And it's
here's the deal. If you took this oral chelation or oral chelation formula every day as a multivitamin the rest of your life, it wouldn't do you any harm at all.
Oh.
So in other words, there's no risk, there's no side effects to an oral formula whatsoever.
Yeah. And that example that you're giving, that one example, that definitely they had to be on it 6 months or more.
Well, was considerable improvement after 6 months. However, I suggested that they stay on it indefinitely because they do have a genetic high risk for heart disease in the family bloodline. And so to this day, they are still taking it as a regular supplement.
And with great results like that, why would you not, right?
Well, yeah, especially with zero side effects involved.
Yeah, there's no reason.